Diabetes type 1 or type 2 can affect anyone of any age, race, or sex. Two types of diabetes are type 1 juvenile insulin dependent and type 2 adult onset. Type 1 diabetes is believed to be due to three things. Genetics is one, an inherited gene type DR3, DR4 are genes that one comes from mother and the other comes from the father. Secondary, diabetes can be from an autoimmune response that is also called a self-allergy. Your body forms an allergy against the islet cells in your pancreas where insulin is made. Thirdly, diabetes is caused from a lack of hormone called insulin. Diabetes is not caused by eating too much sugar, staying up too late, or poor parenting. So what is diabetes type 1? Type 1 is where your pancreas does not make enough insulin in your body. The most common symptoms of diabetes are frequent urination, constant thirst, or weight loss. So you're probably asking, what do I use insulin for? Insulin allows sugar to pass into our cells to be used for energy and also to turn off the body's making of sugar. Insulin also allows food to enter the cells. Without insulin, cells would starve and start using other food sources such as stored body fat. Insulin is essential. If the pancreas stops making insulin, it must be supplied from somewhere else. Insulin must be given by injection. If taken by mouth, the digestive juices of the stomach digest the insulin and destroy it. Insulin is injected into the fat tissue under the skin. Once injected, it spreads into the bloodstream, which carries the insulin throughout the body. Your body has millions of cells, and almost all of them need insulin to help receive glucose for energy. Insulin is made in a lab and is pure. When diagnosed with type 1 diabetes, you will learn how to check blood sugars before every meal at bedtime and along with giving yourself an insulin injection. Normal blood sugar ranges are 70 to 110 before a meal and 140 after a meal. Depending on age, blood sugars may vary in range. There are three important skills to learn so you can think like a pancreas. They include insulin therapy, blood glucose testing, and constant carb diet. There are many different types of insulin, but the most common are Novolog and Humalog, which are fast-acting insulins and are given before every meal. They work within 5 to 15 minutes and can work in your body for 3 to 5 hours. Regular insulin or Apidra are not commonly used anymore because of insulin injection. You have to wait 20 minutes before you can eat your meal, whereas rather rapid-acting insulin you eat immediately. Along with fast-acting insulin, you might also take a long-acting insulin. Most common is Lantus or Levemir. The long-acting insulin is taken once every 24 hours, usually at bedtime. Along with insulin injections, you must maintain a healthy diet by a set amount of carb and learning how to manage a carbohydrate insulin ratio. Another way of managing diabetes is an insulin pump. An insulin pump is a microcomputer that delivers a continuous steady amount of insulin 24 hours a day, 7 days a week, called a basal rate. Along with basal rate, you have to tell your pump to give you a bolus with meals and a correction scale depending on what your blood sugar is. There are many advantages and disadvantages of a pump. An advantages is that you do not have to take insulin injections 4 times a day. Disadvantages are forgetting to give yourself a bolus dose, forgetting to check your blood sugar, or the pump tubing coming out underneath your skin and causing your blood sugars to rapidly rise. Type 2 diabetes is also known as non-insulin dependent diabetes or adult onset. Usually occurs in adults over the age of 40 and or in overweight teenagers, which is becoming more common. Type 2 is partly inherited, but most likely from lifestyle. First treatment of type 2 is a healthy diet and daily exercise. Medications such as pills and insulin may also be needed. People with type 2 diabetes still make insulin, but their body does not respond well to it. According to the American Diabetes Association, there are 25.8 million people in the United States with diabetes, including 7 million that have become undiagnosed. Type 2 is the most common. Currently, there is no cure for diabetes, but researchers continue to search for clues that can help reduce the risk of developing diabetes and can lead to much better treatment for both types and eventually a cure for type 1. My visual aid for this project is the first book of understanding of diabetes. All of my information came from this book. Thank you.